Embarrassing male body problems. 1. Back hair. By the mid-20s, a man will know his back hair destiny, barely there, a few tufts, or full and bushy. Is yours a magnet for women? Or a throwback to the Stone Age? If you want to tame the shag, laser hair removal can thin back hair or remove it all, and the results are nearly permanent. Cheaper options include waxing, hair removal creams, and razors, with results that last up to a few weeks. 2. Beer belly. You don't have to drink beer to get a beer belly. Men are more likely to gain fat around the waist, so anything fattening can pad the paunch. Unfortunately, belly fat raises the risk of heart disease, especially if your waist size is more than 40 inches. But there is good news: if you follow a weight loss plan, belly fat is usually the first to go. 3. Excessive sweating. Men have a higher sweat output than women. That's a fact. But if you always need to wipe your hands or often sweat through clothes, it may be more than a guy thing. It could be excessive sweating, called hyperhidrosis. Emotions or heat or nothing at all can trigger the downpour. It usually affects the armpits, palms, or soles of the feet. Effective treatments are available through a health professional. 4. Unibrow. Now here's a hair problem that affects men of all ages. The same hormones that make your beard grow can make eyebrows so thick and bushy that they meet in the center. Unibrow is the most common reason young men get electrolysis. This procedure uses tiny electric shocks to permanently destroy the hair follicles. Waxing is another way to shape brows, but it must be repeated every 4 to 6 weeks. 5. Razor bumps. You work hard for that close shave. So it can be exasperating when small bumps mar otherwise smooth skin. Razor bumps form when hairs curl back on themselves and grow into the skin. They're most common in African Americans and men with curly hair. To keep the bumps at bay, take a hot shower before shaving. Apply a thick gel, and always shave in the direction your beard grows. 6. Rosacea. Maybe it's not embarrassment that's causing all that blushing. Rosacea is a condition that causes the face to flush, and symptoms tend to be worse in men. The nose may become thick, red, or bulbous. Pimples and tiny red lines can appear on the cheeks. Alcohol can trigger a flare-up, but the distinctive, red nose of rosacea can occur in a teetotaler. Medications can prevent it from getting worse, so be sure to discuss symptoms with a dermatologist. 7. Receding hairline. The painful truth is most guys have noticeably thinner hair by age 35 and significant hair loss by age 50. The pattern usually begins with a receding hairline and may progress to bald spots on the top of the scalp. Hair restoration surgery offers a way to reduce bald patches. Or you can talk to your doctor about prescription medications for hair loss. But beware of other products that promise the moon. 8. Color blindness. Color blindness usually does not mean seeing the world in black and white. The most common form makes it difficult to tell red from green, a problem that affects about 10 million American men. The way the condition is inherited makes it far less common in women. There's no treatment, but most people can learn to work around the color confusion. 9. Snoring. Face the music. Snoring is a surefire way to disrupt your bed partner's sleep, and men are more likely to be the perpetrators. In most cases, snoring is not harmful. But snoring regularly can chip away at the quality of your own sleep. It can also be a sign of a more serious problem called sleep apnea. If you feel snoring is disrupting you or your partner's sleep, consult a doctor. 10. Belching. Burping may not be the picture of politeness in American society, but in some cultures a hearty belch shows appreciation for a good meal. In either case, burping a few times after eating is normal. It's the body's way of freeing the air that you've swallowed. Frequent burping combined with other symptoms, such as nausea or belly pain, could be a sign of a digestive disorder. Check with your doctor if the problem continues. 11. Gas. Perhaps no bodily function has inspired as many jokes as gas. While the sound and smell can be embarrassing, passing gas is harmless. It's nothing more than air moving through the digestive tract or gas from the breakdown of food by bacteria in the gut coming out well, we all know where. Gas facts: most people pass gas 6 to 20 times a day. Beer, soda, beans, and many fruits and vegetables are all likely to gas you up. Foods that cause gas differ for each person. 12 Body odor: whether you're working hard or playing hard, any strenuous activity can result in strong body odor. The culprit is not sweat itself, but the bacteria that use sweaty skin as a breeding ground. You can fight the bacteria by showering regularly with soap and using antiperspirant. Also be sure to wash workout clothes often. If body odor persists, try avoiding smelly foods like garlic and onions. 13 Jock itch: you don't have to be a pro athlete to get jock itch. This fungal infection spreads easily at your local gym or from another part of your own body. Hands, towels, and stepping into underwear are common culprits. The symptoms include a patchy rash on the groin or inner thighs, along with the telltale itching. It's treated with non-prescription antifungal creams. Keeping the area dry and avoiding tight clothing helps to avoid a repeat engagement. 14 Athlete's foot: when the fungus that causes jock itch targets the feet, you have athlete's foot. Walking barefoot in locker rooms or near pools is the most common way to pick up this infection. Symptoms include itching, burning, blisters, or cracks on the feet and toes. Athlete's foot is treated with antifungal cream. If you have both jock itch and athlete's foot, be sure to treat them at the same time. 15 Ingrown nails: grooming nails may not be the highlight of your day, but it's worth your time to get the job done right. Clumsy nail trimming is the top cause of ingrown toenails, which can cause pain, swelling, and infections. The most common mistake is trimming the nails too short. To avoid this, check the drugstore for nail nippers that are shaped to follow the natural curve of the nail. 16 Bad breath: you probably know that smelly foods and smoking can sabotage breath. But the most common culprit is bacteria. When you brush teeth, brush the tongue as well to banish the bacteria that thrive there. If good hygiene doesn't sweeten your breath, see your dentist and doctor. Gum disease, dry mouth, or acid reflux could be part of the problem. 17 Sexual dysfunction: men may not be eager to discuss sexual troubles, but nearly a third of guys experience problems. This may include a sagging libido, premature ejaculation, or erectile dysfunction, ED. ED means a man is unable to develop or sustain an erection. Risk factors for ED include diabetes, heart disease, neurologic conditions, smoking, circulation problems, and some medications. Talk to your doctor if you have ED or other sexual problems to help evaluate the problem and recommend treatment. 18 Hearing loss: men are more likely to experience hearing loss than women, and noisy jobs may contribute. Think miners, carpenters, and soldiers. But any loud or continuous noise can damage delicate ear structures, including music piped in through earbuds. On the job, use special ear protection. Keep personal music players at or below 85 decibels, dB. Most can crank up to 105 dB, louder than a motorcycle, wood shop, or snowmobile. 19 Enlarged prostate: along with wrinkles and gray hair, an enlarged prostate is an unavoidable part of aging for many men. The medical term is benign prostatic hyperplasia or BPH, an enlargement of the gland that surrounds the urethra. This growth causes symptoms in about half of men over age 75. As the prostate grows, it may squeeze the urethra, making you feel nature's call more often. There are strategies and medications to help reduce the symptoms.